Hi, I'm Sophia Jones. I will be doing a lower limb assessment on my good friend Ty. She's 5'2". She is very normal and seems like a healthy young woman. So first thing I'm going to have her do is stand in a good posture, everything aligned. I'm going to look at her feet to see if she's flat-footed. I'm looking at her knees if she's not needed and it appears to be normal. I'm looking at her hips to see if her pubic area is twisting. Next, I'm going to have her stand on her leg for 5 minutes, and she's able to do that, which is good and normal. Next, I'm going to have her do a one-leg squat, and I want to see if there will be any internal or external rotation with the knee, which appears to be normal. Now, I'm going to have her get on the table and do a Thomas test. And I want you to hold your knee to your chest and go back. And what I'm looking for is to see if this leg is touching the table. If not, there is tightness in the psoas area. Next, I'm going to have her lay on her back and do her bridge. And I'm testing to see if her ASIS drops. So, checking that. Appears I don't palpate, I don't touch a drop. Okay. In the ASIS. Next, we're going to check for range of motion. And with the range of motion of the hip, we're going to see if it internal and externally rotates. We're just going to do that. And next, I'm going to palpate the ASIS and her pubic bone. Okay. Next, I'm going to do a 90-90 test of her hamstring to test her hamstring length. So I'm just doing that, testing the length, and it appears to be normal. Next, I'm going to have her lie on her side.
Should I do this one?
And I'm just going to feel for tenderness of her trochanter and her psoas. And next, I'm going to have her place her thigh right here, and I'm just going to touch for tenderness of the adductors and the psoas. And when there's tenderness with the adductors and psoas, that tends to me like, ositis pubis. That's a sign if it's like tenderness to palpate the adductors and psoas. Next, Ober test. So I'm going to have her lie on her side. And I'm just gonna have her her knee touch the table. And if it does touch the table, then she does not have tightness in her ITB. Next, I'm going to check the ability to hyperextension. And when she has the ability to hyperextension, it helps for walking. So I'm just gonna have her flex her leg, and I'm just gonna touch her knee. Press down on the knee and have her leg flex. And I'm also next going to check if her patella moves 2 centimeters in all the directions. And I'm feeling it, and it's moving 2 centimeters in all the directions. Okay, and I'm going to have her tighten her VMOs and see if they tighten at the same time. So they're tightening, good. Next, we're going to do the Lockman test. And with the Lockman test, we're just going to test the ACL to see if it's intact and test the integrity of the ACL and see if there's a click or a pop. Next, we're going to do a quad test, and I'm just going to move this around. And when I'm moving around, I want to listen for a click or pop, because if there's a click or pop, it's usually a sign of a labral tear. Next, I'm going to do the McMurray test. And with the McMurray test, I'm going to check to see if the meniscus is intact. And we're just feeling for that. And I feel a meniscus intact. Next, PGM. So I'm going to have her lie on her side. And I'm going to put her leg at this angle because we're testing to see how strong her glutes are and if her glutes are weak, she will not be able to hold this pose. So I'm just gonna have her hold. And it looks like she's able to hold this pose, so she does not have weak glutes. And we're going to have an Eli test. And with this, we're just gonna check for her quads and tightness of the quad. So she's able to have her foot touch her butt, so it's not a lot of tightness in her quads. And that is the ending of my lower limb assessment. And thank you, Ty, for being my patient.